Okay, welcome again, everyone. My name is Yarrow Wilman-Cole. My pronouns are she, her, and I am the Workplace Justice Program Director at New Jersey Citizen Action. Please continue to introduce yourselves in the chat. I am going to provide a little bit more context in a minute, but I first want to let my colleague Nat introduce himself.
Thanks, Yarrow. Hey, everyone. My name is Nat Mogay. My pronouns are they, he, and I am the workplace justice organizer here at New Jersey Citizen Action. And yeah, I'll be helping facilitate today's training and today's panel. So super excited.
Thanks, Nat. Okay, great. Welcome, everyone. Again, this is a paid leave outreach collaborative lunch and learn. The name is Maternal Health and Inclusive Paid Leave Through the Lens of Equity. Nat, actually, if you would like to go to the next slide, this is a slide of the organizations or the groups hosting the event today. Nat and I work at New Jersey Citizen Action. There's a description of our organizations. We also have our sister organization, New Jersey Citizen Action Education Fund. And we also helped to convene the New Jersey Time to Care Coalition. A couple of the guests on today's panel are part of the coalition, Garden State Equality and March of Dimes. We'll thank them, of course, for being part of that effort. The coalition has been working together to pass policies that help workers afford to take time from work to care for their loved ones' health. Also, the Paid Leave Outreach Collaborative was formed to be dedicated to the awareness of what paid leave and other protections are available in New Jersey. And I'm going to be running the training, which will begin after our panel discussion. So again, welcome everyone. We are hosting this training to recognize Maternal Health Awareness Day, which was just the other day on June 23rd, and then highlighting the connection between paid leave and maternal and overall health. But I just want to say before I begin and provide the background and context for today's discussion, I want to actually take a minute to, talk about or acknowledge the really frightening situation we find ourselves in under the Trump administration. Everyone here, I'm sure, has felt this threat. Our communities are under attack. Immigrants, LGBTQIA, trans community, workers, women, children, and we are all facing real threats. And I want to make sure that we connect and support each other at every step. So one of the resources we wanted to share with you was the New Jersey Alliance for Immigrant Justice. They have a really great page, Know Your Rights, more information that they've put together. Also, Garden State Equality has lots of helpful information for folks that are looking for info, specifically on, there's lots of resources, but on how Trump's executive orders have impacted gender marker changes and LGBTQ plus affirming healthcare in New Jersey and lots more. So we'll pop those links in the chat for you all and send them in follow-up. And also, please feel free to share any other resources that you think folks might find helpful. We are also doing a sign-on letter that urges members of Congress to oppose freezes on federal funding. This is a sign-on letter for organizations, and it's fine for any organization, C3 organizations. Of course, getting approval from your organization to sign on, but the more folks we have signing on to that letter, the more powerful we are in resisting these threats. So thank you, everyone. We're in it together. If that's reassuring, I don't know, but okay. So all that being said, I want to bring it back to the conversation today. So yeah, there is a growing body of research. It's common sense, but the research is really showing us how access to paid leave can help lead to improved health outcomes broadly, and then specifically in terms of improved maternal and infant health outcomes. But there are racial and income disparities in terms of who can access paid leave. And, it's often the same Black, Brown, and Indigenous families who are most at risk for poor maternal and child health. They are also those least likely to have access to paid leave. Again, Black and Brown Indigenous birthing people face higher risk of complications and mortality due to systemic healthcare inequities. And so, equitable access then to paid leave and making sure our policies are available to all, and our protections, that we are afforded here are something that people are aware of, and it's really important. And we, of course, need to center Black birthing people and the reality of the risks imposed by structural and medical racism, and that there are still also disparities and barriers and discrimination that LGBTQIA plus folks experience in the workplace and in healthcare. And so with the Black maternal health crisis, and of course, as I mentioned before, the attacks on LGBTQIA and transgender rights, living in a state like New Jersey and sharing the benefits and protections that are available is really critical for our community's well-being and their access to bond, care, and heal. But before we go on, we want to share a very quick 3-minute video that talks about a community-based doulas and midwives addressing the U.S. maternal health crisis, and provides some context for the conversation and some other voices. Now, if you can share that video.
In the United States, women of color face disproportionately high maternal mortality rates, and pregnant people of color and LGBTQ pregnant people face high rates of discrimination and denial of quality health care. Black women alone are 3 to 4 times more likely to die from pregnancy-related causes than non-Hispanic white women, and twice as likely to lose an infant before their first birthday. But why is that? While there is no one factor, experts say racism, discrimination, bias, and exclusion are driving forces.
I think that we are really hobbled by systems and institutions that have racist policies, procedures, and yet we are not really willing to dismantle.
Living in America as a Black woman does something to your body. It can be everything from I feel that I'm treated differently to I am being discriminated by the police in housing and in my workplace. Those have a physical effect on the body.
According to the CDC, 60% of pregnancy-related deaths are preventable, and multiple studies have linked improved health outcomes to the support of community-based midwives and doulas.
When people are seen and they know that this person really cares about their well-being and they're hearing them, the same way my midwife and my doula made me feel, I want other people to feel the same way.
We know that community building makes a huge difference. We know that when people are struggling in their postpartum, they need community support.
During the process of birth, which is such a vulnerable time for people, getting vulnerable with a person relatively quickly during this experience, I think that can be having someone from your own community can be extremely beneficial.
Birthing people need accessible, affordable options to a range of pregnancy-related care that integrate community-based doulas and midwives.
Birth is normal. It's not a medical event. It's a life event. Unique families need to be supported by extended family that need to be supported by community.
My vision would be that we would never be counting and adding up these horrendous statistics and throwing our hands up and saying we don't know. That we would always be able to say that if there's nothing else, we cherish our own and each other's humanity.
Responses to the maternal health crisis must center the communities most impacted. Share this video if you agree.
Thank you. So we wanted to share that video. We think it's really powerful, and even in its 3 minutes, well, Nat and I, we're not experts in maternal health, but because of the focus on maternal health, we wanted to share that. And we will talk more in the training, but we want to first just mention as we get ready to open the panel that New Jersey does have paid family medical leave benefits that support workers regardless of their race, their sex, their gender identity, or their family structure. It's not maternity leave for moms, it's family leave for all parents, and caregivers for all loved ones. And New Jersey really was a trailblazer on this part. We passed policies to ensure that workers could take paid family leave for caregiving for really anyone they define as family, including chosen family. And this really helps in the recognition of the importance of supporting diverse family structures in policy and in legislation. Diverse families have always existed, but laws haven't always acknowledged that. And sometimes they've actually actively harmed the structure of our families. They sometimes deny cash benefits to unmarried moms, define marriage as a union limited to man and women. These policies are harmful. But policymakers can use the construct of family to make determinations about access to rights, resources, and benefits. And restricting family definition does marginalize different types of families. Single families, blended families, families headed by same-sex couples, and chosen families. And it can also reinforce structural inequities, including those based on race, gender, sexual orientation, citizenship, age, and ability, and disproportionately affect individuals and families living at the intersection of these identities. So, while access to our paid leave programs is not always equitable and barriers do exist, the fact that we have inclusive family definition and other really strong protections for all workers in New Jersey is a bright light. And we want to make sure that folks know that and can share that out. So we're going to be discussing some of these ideas and themes in our panel and in our training. But first, I want to go ahead and actually start the panel. So Nat is going to kick off our panel and facilitate it. So welcome back, Nat.
Great. Thank you, Yarrow. And yeah, to everyone who just joined, just to reintroduce myself, my name is Nat Mogay, and my pronouns are they, he, and I'm the workplace justice organizer with New Jersey Citizen Action. And yeah, I'm super excited to be facilitating this really, really important conversation. And I just wanted to thank everyone for being here in this space, and thank everyone for, being present. So I'd like to invite our panelists actually to, introduce themselves, tell us a little bit more about yourselves and your work and how it relates to, supporting the health of workers, maternal health, and child health. And we don't have Sasha here today, but I would like to give a shout out. We did have a panelist from the Queer Doula Network, but yeah, definitely excited to have Shakira and Lauren still here with us. So yeah, I'll kick it off to Shakira.
Hi, everyone. Good afternoon. Thank you for taking the time to spend your lunch hour with us. Thank you to Yarrow and to Nat and New Jersey Citizen and Time to Care Coalition for creating this space for this very important discussion. And it's an honor to be here on the panel with Lauren as well. So just to introduce myself, I am the Director of Maternal Infant Health with New York and New Jersey with the March of Dimes. And on a daily basis, I collaborate with partners and volunteers throughout New Jersey and the bottom half of downstate New York. And I serve on numerous boards, committees, coalitions, blah, 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 just to make sure that March of Dimes, their priorities, which are to reduce preventable maternal deaths and preterm births by using equity and social determinants of health lens with the focus on improving maternal and health outcomes. Now, how do we do this? We support research towards solutions that ensure every baby is born healthy. We advocate for policies that prioritize the health of moms and babies. We provide resources and programs to help moms before, during, and after pregnancy. We educate medical professionals on known solutions that will help improve the care that mom and babies receive. We unite local communities like ourselves, and we partner with organizations like New Jersey Citizen and a Time to Care Coalition and a ton of others. So collaboration is really important so that we make sure that we're committed to helping moms and babies.
Great. Thank you so much, Shakira. Appreciate that, and really, really do appreciate, all of the work that you and March of Dimes do for our communities. And Lauren, I'd love to give you the space to introduce yourself as well.
Good morning, everyone. Good afternoon, everyone. Thank you for having me here. I'm Lauren Albrecht. I'm Garden State Equality's Director of Advocacy and Organizing. I'm honored to be here with you, Nat and Yarrow. I love working with NJCA. You guys are so comprehensive and inclusive in your programming and in your outreach, and it's really an honor to be in this space with you and Shakira as well. I'm really glad to meet you. So at Garden State Equality, we have any number of programmatic and advocacy avenues. And really for us, it's about the whole person as the LGBTQ person. So that does include obviously maternal health. LGBTQ people are parents. LGBTQ people birth children. LGBTQ people need leave to take care of their families. And so that's really our interest or stake in this. We prefer to let organizations like NJCA lead on an issue like this, and we can provide our voice where it's helpful and needed to make sure the policy is helping who it needs to help, right? And addressing the gaps that perhaps may not be seen in the overall picture, but can be seen when we bring an LGBTQ lens to it. And we're grateful for the opportunity to do that with you all. As Nat and Yarrow know, we've worked before on some more like campaign related stuff about inclusive paid family leave for all. I believe 2 years ago at this point, a year and a half ago at this point, which is the first time we worked on this with y'all. We do have a health and wellness department here at Garden State Equality, and some of the work that they do is maternal and prenatal, postnatal with LGBTQ people who are pregnant or who have kids. We also, the follow through of that is, and again, like I said, our focus is the whole LGBTQ person. Occupy, honey. Sorry. This is what happens when we're in the office all together. It's hard to get 5 seconds alone in like a closet. The focus is the whole LGBTQ person from preconception to childhood to adulthood to being a senior. And so from our maternal work, from our work within in maternal justice and equity for LGBTQ people moves right into how do we support LGBTQ people to be parents? This is a seamless sort of transition, and there is no one part without the other. How do we support LGBTQ people to be parents? How do we support people to be parents of LGBTQ people? And we have to look at it as a continuum instead of in pieces. And so we're grateful for the opportunity to bring our voice to this piece of the continuum.
Yeah, thank you so much, Lauren. And yeah, Garden State Equality, just as like a trans and queer person, like yeah, Garden State Equality has definitely had like a impact on my life and like has been helping me, it had just helped me a few days ago with things that I'm going through with ID changes, right? So really appreciate, both of you being in this space. And yeah, let's go to the first question. Shakira, tell me what your view is on the role of paid leave when it comes to supporting improved health outcomes. And also, I'd love to know like your thoughts on how to increase awareness and access to paid leave and how to like overcome barriers.
Absolutely. So first, I just want to let folks know on the line, if you don't know of March of Dimes, we've been in this business for moms and babies for 86 years. And if you said, hey, what's March of Dimes all about? If you received a polio vaccine, if you ever had legislation pushed for you at our nation's capital, that's typically what March of Dimes has been doing for the 86 years it's been around. I am just one of about maybe 600 people who work at the March of Dimes on a daily basis all across the grand United States. And one thing we focus on when it comes to paid family leave is ultimately we want to see healthy babies and healthy parents. We look for stronger family bonds, reduce financial stress, and more productive employees. It's a win for families, businesses, and for our communities on a whole. Now, I wanted to bring to light a couple of years ago, back in 2020, the March of Dimes Center for Social Science Research funded a study conducted by the Institute for Women's Policy Research, and which highlighted long-term effects of paid family leave on women working in the United States workforce. And this study is a part of what March of Dimes uses as ongoing work to better understand the many medical, social, and economic factors that contribute to maternal and infant health crisis that's facing our nation, which I'll talk a little bit about a little bit later. But let me keep on telling you a little bit about the study. So the study, this was all shared on the American Economic Association meeting, and it looked at labor market participation of birthing people in California, and guess where else? The great state of New Jersey. And we looked at before and after the state implemented the paid family leave and medical leave system. And some of the key details that you can take away from that study is that states that implemented a paid leave policy found that 20% fewer birthing people leave their jobs in the first year after welcoming a child, and that's by birth, by adoption, or foster, and up to 50% fewer leave after 5 years. So with that being said, fewer birthing people who did not have access to paid leave, the study found that welcoming a child, 1 in 5 women will not return to the workforce over a decade. We're looking at 10 years that you may not return back to the workforce. And then it says and answers the question, why does paid family leave matter? Over long term, paid leave nearly closes the gap for workforce participation for birthing people of young children and birthing people without minor children. So those are people, anybody who's above the age of 18, maybe they have a child and they're a guardian to a child that has special healthcare needs above 18 and into their adult years. Nonetheless, the research is yet another proof of the value of paid family leave, which not only benefits the economy and family finances, but the health of moms, babies, birthing people, including the lower rates of neonatology and infant deaths and infant mortality. So that's very pivotal in terms of what we believe in here at March of Dimes and how strongly we advocate, not just at our nation's capital, but also here in New Jersey. Any opportunity that Yarrow and Nat offer to me to come out to the State House and submit a ticket or oral testimony as to why why our families here in New Jersey we must have paid family leave at great lengths, I take that opportunity to do so. So I think you talked a little bit about and about barriers and how to overcome barriers. And what we talk about at March of Dimes in regards to policies, and especially for the paid family leave, we look at making sure that we're advocating for stronger paid leave policies at the federal, state, and local levels so that we can ensure what we call equitable access, which is very important. We also look at that respect for policy and advocacy expansion. So not just talking, but actually hitting the pavement and doing what we need to do to get this work done and letting folks know about it. We also want to make sure that we normalize taking paid family leave so that employees, they don't fear stigma and retaliation. And that's important. In my family, I'm a mother of 3 children, and one of them was born of micropreemie and born in at 1 pound 8 ounces and had to live in the hospital. And I remember when I had my baby, I was working with a major international company. And I remember going into the office after having my baby, and I had some time off, not a lot of time, just like really, I kind of got right back to it quickly. And again, fear of losing my position at that point because I felt like I had a pivotal role in that organization. And I remember the person who supported me saying, let's go to human resources, see if we can get you some time where you can go see your baby in the hospital if you want to while you're working or what have you. And sitting across the desk from this male, and he said, well, I don't understand why she needs paid family leave. She's not taking care of her baby. Her baby's in the hospital. And that just hurt me to my core. And I was young. I was young at that time. And when I say young, not just mentally young in corporate America and not knowing how to handle myself. And I was still emotionally a wreck being able to give birth to my child and not take my child home with me and not knowing, where in between I fit in my company. And I'm so glad for this woman named Anne Marie Castro, who took me under her wing and said that what he said was inappropriate and that she made sure that I, got any benefits that were allowed to me under paid family leave in that respect. So that I could, I can continue to contribute to my family financially. All right. Because I had another child, I had a husband, and so that was important. But I say all that to say, I don't want anyone to ever have to go through that, feeling that you can't stick up for yourself because you think that your job is going to be taken away from you. The other thing is public awareness and education. Making sure that we have clear communication and that we're talking and making sure that social media is our friend and getting it out to whoever needs it. And if it's by mail or social media, whatever the form of communication, getting it out there. And it's important to collaborate. Again, in 2023, New Jersey Citizen offered a training on Train the Trainer for paid family leave. And I completed that training. And with Yarrow and Nat, and in 2024, Yarrow and I co-trained 43 members of the Order of Eastern Stars in Roselle. Now, the Order of Eastern Stars, they're sisters to the Masons, the Masonic, and they've been around for centuries and in across the nation. So it's important to tell the people who are really in the community, hitting the pavement, having interactions with the community, what's going on, so they can let folks know what to do. And out of that one chapter in turn has made it a reoccurring conversation at their meetings, and different community events. And also when you're addressing barriers to access, I when a Time to Care offers partners to attend meetings, like I said earlier, whether it's their lobby day or meeting with the Department of Labor in New Jersey to discuss, let's talk about it. Let's tell those folks who are making these rules how they can simplify their application and really, combat misinformation, and how we can really support our caregivers who really are the crux of our society. Expanding paid leave to cover all people, not just new parents, but all people. And that's very important. And I'm going to now pass the microphone over to Lauren. I don't want to make this the Shakira show because I love talking about things like this. I can go on and on and on.
No, I really, really appreciate that, Shakira, and like, yeah, like I feel like that was like just a great way to like also to just like emphasize like the power of like sharing like our lived experiences, and like I just want to thank you as well for like sharing, your story with us. But yeah, I'll pass it on to Lauren.
So first of all, there's nothing wrong with it being the Shakira show. I learned a lot from listening to you. And so I thank you for that, and never apologized for being an expert in something and speaking competently to it. So for our part of the work, the reason that why what's interesting about it to us, and what attracts us to this kind of work is that at the end of the day, it is an equity issue, and at the end of the day, everything that negatively impacts a person will be more negatively impacted on them if they are an LGBTQ person, and then again if they are if they are an LGBTQ person and a person of color, or a person of a lower socioeconomic standing, or a disabled person. And so that's the way that we view it. And it's, to us, it's important to recognize the things that are already in place when a person is LGBTQ or identifies as LGBTQ. So what we're talking about is people who are LGBTQ who are more inclined to change jobs more often. People who are LGBTQ who are more likely to exist at a lower socioeconomic standing, make less money, right? And people who are LGBTQ who are, whether it is real or perceived, less protected in certain aspects of the law than people who are not LGBTQ will be protected. So what that comes down to, so for instance, as Shakira shared, 1 in 5 people will not come back to work right after a maternal stay or having a baby or being pregnant. But for LGBTQ people, that comes with an added sort of burden or caution, in that we will always view that as grounds for, could I get fired for this too? And so people who are LGBTQ are less likely, if they have a job that's working for them and it's paying their bills and they're solid in it, they're less likely to want to take paid leave or want to take time off, because can that be used against me? I'm unclear on what the requirements are for me to be fired. Is this going to be used as an example of my dereliction of duty when it comes down to? So I think that, we're more likely to view things through that lens too. I'm already LGBTQ. I'm already feeling like I exist in this marginalized place. And then if I take the things, even the things that are due to me or owed to me or are provided to me by law, am I more likely to put myself in a position where people are reviewing my progress and viewing it negatively? People are reviewing my attendance report and viewing it negatively. The other thing is that LGBTQ people, as a general rule, and this may not apply to the LGBTQ people that in your life, right? That live in New Jersey, that own a house, that, commute to the city, that have a good job or whatever. But by and large, LGBTQ people skew more towards gig economy. So places that may not offer necessarily paid leave or expanded family leave or any of the benefits that many of us have. And then that we are also inclined to exist in places that are sort of like, not necessarily you go to an office 9 to 5 every day. So these are, what we're talking about is sort of lower wage workers in the pronounced wage gap. And lower wage workers are obviously much less likely to have access to all forms of paid leave. For instance, we are more likely to work in food and beverage or retail. We are more likely to perhaps not have the benefits that a 35 or 40-hour work week does come with. And so for us, it's about filling in the gaps to make sure, it's about making sure that the law is expanded like a rubber band to capture all of this identity that we may have that is different than our straight and cisgender counterparts, but then also how we fill in the gaps too, as an organization, as a community, how we show up for each other in the gaps or the sort of the places that we aren't covered necessarily by what our employer covers, or things like that. Yeah, so we, in short, we don't always qualify for the standard leave. We don't always qualify for any leave at all, actually. And the policy that a lot of employers have of like needing to be at an employer for a year often excludes us if we're not at an employer for a year, or if we can't be at an employer for a year. The other thing to think about is that many of us still worry about disclosing who we're taking time to care for. So if you're in a place that you don't feel is LGBTQ friendly, if you're in an employer that is, you don't feel like it's LGBTQ friendly, obviously in New Jersey, we're robustly protected by the lab, but that doesn't mean that we don't have the perception, right? That there isn't some perception that if I tell them that I'm taking time off, me as a woman, if I'm taking time off to care for my wife, or if somebody finds out that I'm taking time off to care for my partner while they're undergoing gender affirming care, these are things that kind of stick in your head and sit in your head like, I'm going to be discriminated against for this. I can't even say this out loud. Which leads to a lot of discomfort. Everybody likes to feel comfortable and appreciated and valued at the place they work. And if who you are as a human and your identity is not accepted there, you're obviously going to be worried that you're going to get fired for it, regardless of what the law says. And so, I don't know if we got to it yet, Nat, because in full transparency, I blanked out for a second when somebody came in the room and then I got a phone call. Did we get to the point yet in our questions about how we changed, sort of change the perception of what maternal leave means?
Yeah,
Or is that?
so Next question, we'll get into more of like the language, but I do really, really appreciate like you bringing up, the barriers that like we as like LGBTQIA people often face, and then like, even like reminds me like just to share my experience, like as a trans person, right? I was out without a primary care doctor for 3 years, not because of first being discriminated against, by my former primary care doctor, and then also just like the process of trying to find a new affirming doctor, affirming doctor, therapist, even like the process of going into the motor vehicle office and doing your driver's license, even like before you go to do that, like that feeling like you were describing, like that fear of discrimination is very, very present in all of us. So I really do appreciate you highlighting that. And yeah, we could like that definitely, I feel like, goes into the next question. Which is talking about how, New Jersey's paid family and medical leave programs, the language that are used is very gender neutral. So I'd love to know your thoughts on like how we could use inclusive language and imagery to inform, expecting and new parents of their rights, right to leave, while still meeting people where they're at. And for an example, many people still think of paid leave as maternity leave, but that's not the technical term for the benefit. In New Jersey, the programs are temporary disability, and family leave insurance. So how can we ensure that everyone feels included, when discussing paid leave and in doing outreach? And yeah, I'll pass it to you, Shakira, first.
Thank you. I always need questions like this to help ground me because even some of the research that I talked about that was done and conducted in 2020 with March of Dimes, they clearly use the word maternal an awful lot. However, I've been in the organization for just about 4 years now, and I know the organization on a whole strongly uses inclusive language. I'm a huge proponent of people first language. So when I say that, we try to say paid family leave. I always try to remember paid family leave and using the context of family and that bonding, the time for birthing people to bond with their children, and their new children or significant others, and caregivers, because that's what you are. In essence, you're a caregiver to that person. So those kind of words like that, it makes it feel like a more inclusive community as far as I'm concerned. And we all have biases. And sometimes when you're embedded in and having biases, you have to really look in the mirror and check yourself on a regular basis, as I do as well, and make sure that we are using words that make people feel comfortable. Because if you're not, that automatically will turn the switch off and they don't want to hear anything you have to say. I do, March of Dimes does have their mission and their vision, and it does clearly say, and one of our taglines often say, moms and babies. That's what we're in the business of doing. That's their mission. That's included in their mission. However, when we're speaking like this, we get to infuse our own personalities and our own individual speech. And we want to make sure that we're trying to be inclusive and make everyone feel comfortable, including ourselves.
Yeah. Yeah, definitely. Thank you. And yeah, I think that that's like important to highlight. I think, um, a lot of the times, like we also feel like we need to find just like LGBTQIA specific spaces, and we could only go to those spaces to find our resources or to have these conversations. But like you were just describing, like having these conversations, even in, you know, spaces where it's not centered in the mission, but still using inclusive language, and you know, being open to all different types of identities, I think is really, really important and makes a big impact. And yeah, I'll pass it to you, Lauren. And I feel like you're going to touch on this, but I'd also love to know, like, if you have any thoughts on like the use of like inclusive language when it comes to like you know, and our doula was actually going to speak on this as well, but our language when we talk about like breastfeeding, and you know, trans folks who use the term chest feeding, and how we could incorporate that even into like more know your rights content and just our discussions.
Thanks, Nat. So to echo everything Shakira just said, we make change in the way people use language or the way people think about things by implementing it ourselves, right? You know, being consistent in our own messaging and being steadfast in our position or point on this. To your point, Nat, so when we talk about breastfeeding, chest feeding, for instance, I myself being a cis woman, if I were breastfeeding, I would be comfortable using the term breastfeeding, but with the understanding that not everybody is comfortable using the term breastfeeding. So we try to be as gender neutral as possible in that. But, you know, if somebody has made a point of saying to me that they breastfeed, then I'm not going to put on them that they're chest feeding. I will obviously honor the choice that they have made to refer to what they're doing as breastfeeding. You know, or a birthing person who births other than besides, you know, mother or, you know, pregnant woman. You know, I think language justice is in a lot of ways honoring the language choices that a person makes about themselves, while recognizing that that is not a one size fits all for everybody else. And that's often a challenge, I will say, you know, in the work that I do, probably that you do, is finding the right balance between honoring the dignity of everyone and making individuals feel seen, or feel not catered to is not the right word, but feel honored in their individuality, right? I'm not the kind of person who would get up in arms about somebody calling me a chest feeding person. But like I said, if I were discussing what I'm doing, I'm breastfeeding. There are going to be people who don't operate from a baseline perspective that we may operate from in this room, which is to understand that trans people can become pregnant, trans people can impregnate. We probably, most of the people, I don't mean to speak for anybody else, but probably most of the people in this room understand that we operate from a baseline that is more inclusive, and that is honoring the identities of everybody separately and individually. There are going to be people that we're messaging this to who don't understand that, right? Or don't operate from that baseline. And, you know, do I go about trying to deconstruct the foundation of what they consider to be the acceptable language for this? Or do I try to like go in there and decolonize their understanding of gender and who can become pregnant? Or do we make a marketable message that gets as many people as possible on board with the concept of expanding family leave for all? And that's always a balance in advocacy, right? Who are we speaking to at this very moment? Who do we hope to attract with the message? What attention do we need to garner to get our mission done? And this is a highly nuanced question about that. But again, Garden State Equality will always defer to the gender neutral and most inclusive position. I hope that answers the question.
Yeah. Thank you. Really,
And
really appreciate that.
Nat, I just wanted to also add that, you know, sometimes when you're just unsure, and I know we have some, you know, birth workers on the phone, you know, they're paid leave advocates and organizers on the phone, just ask. I mean, just say, listen, I don't know. I don't want to offend anybody. So listen, tell me, what is it that you prefer? How would you like me to reference? Just
Yeah.
ask. It's nothing wrong, to ask. And if you're not sure, just be vulnerable and say, I don't know. I'm not
Yeah.
sure, but I want to be respectful. So, let's play this out.
Yeah, just like trying to like understand each other like as human beings, like even if we don't always have like the knowledge and understanding. Like I think like asking questions goes a long way. So definitely like appreciate you both for your perspectives. And yeah, for our final question, and I'll open the space to both of you. Feel free to answer if you want. I'd love to know if anyone would want to discuss how we could help address the Black maternal health crisis, and support efforts around improving maternal health in New Jersey.
I'm gonna say one hand and two hands. I would like to talk about it. This is one of my specialty areas. I identify as a Black American, so this is what I do. This is my business here. So I don't know how many people on the phone are know about what's going on in terms of this crisis throughout the Americas, but I would like to take a few minutes to talk about it. And I think this is a great opportunity, not just in this space, but also because it's maternal awareness, week here in the state of New Jersey, which started here in New Jersey. So there is a human component to what I want to say. I'm going to talk about some numbers, but these numbers translate to people's lives. These are birthing people, different people from all walks of life who are included in this data. And this data I'm going to talk about right from the March of Dimes report card. And anybody can go online. I always say, listen, you can listen to Shakira. I'm going to tell you what I need to tell you. But if you really want to know, go online yourself and see what I'm talking about. The best way to do it is do the searching. So I invite you to go to March of Dimes report card, March of Dimes maternity care desert reports. It's all information that is at no expense to you. You can go on and use this data as you'd like to. So just to let everyone know, the United States remains amongst the most dangerous developed nations for childbirth. And this is extrapolated right from the report. 2 women will die from pregnancy-related causes today and every day. And 2 babies will die every hour in the United States. So the hour that we're here together, just know that 2 babies are leaving us. Pregnancy-related deaths have more than doubled over the past 30 years, and 2.2 million plus women live in what we call maternity care deserts, and that's where they have no hospitals offering obstetric care. And we have them here in New Jersey. But even more alarming is 350,000 babies are born to women living in counties with limited or no access to maternity care. And in the great state of New Jersey, we have 21 counties. The one access is Cumberland County. And I'm from New Jersey. I'm born and raised. And I kept saying to myself, nah, I don't go to Cumberland County that much. I've been here all my life. But I did. When this report came out, I said, let me go and see what's going on in Cumberland County. And I did see how their hospitals are disappearing out there. And if they do have access to obstetric care, it's very low obstetric care. And they have a shortage of physicians and OBGYNs and nurses. So understand that part. Higher mortality rates in the United States compared to other countries can be attributed to several factors. You have systemic issues, healthcare access, lifestyle factors, and what we call the good old social determinants of health. And if you know these numbers are alarming, what I just talked about, once you stratify it by race and ethnicity, those numbers are even more alarming. They're even more dire of a need for us to get out there. So let's talk about New Jersey. Wait, United States. You hear them say, oh, Black women are 3 to 4 times more likely to die as a result of pregnancy complications in comparison to their white counterparts. But when you talk about New Jersey, a Black identified woman is 7 times more likely to die from pregnancy related complications. And Black babies are 3.5 times more likely to die before their first birthday in comparison to their non-Hispanic and Latinx counterparts. So when we're talking about it, we are carving out, and I do have a slide that I can show you in terms of where we are in the bar graph, because I'm only uplifting Black skinned people, people who identify as Black, because that's the question. But I do have a slide. I know it's not a presentation, but I do have something. So when you talk about addressing these factors, it requires systemic reforms, targeted interventions, and investments in public health and social infrastructure. You cannot address these issues without tapping into each one of those areas. So let me break it down a little bit for some of the people who are listening. I mean, I do this every day, but I would make sure I do a nice breakdown for people who don't hear it every day and don't, or just enlightened by it for the first time today, maybe. So when we hear the words like unequal access to healthcare, delayed diagnoses, implicit and explicit bias in healthcare, structural inequalities, and systemic racism. And that goes for Black Americans and for others, just to let you know. It's not just, it shows it rears its ugly head in so many different ways. So I said the word systemic racism quite a bit, but I just want to give you a little bit more meat and potatoes behind that, or just some, oh, now I'm not being sensitive again to some people who don't eat meat. But let me give you some context, okay? When you think about systemic racism, it's a form of racism that's embedded in a system, laws, policies, and practices of society, and it can manifest itself in so many different ways. It can be institutional structures, such as policies and practices that are given to certain groups that are unfair advantages while treating others unfairly and harmful. And this is in general, not just with Black Americans, but just in general. And social structures, such as laws and programs and cultures that contribute to racial inequality, individual mental structures, which is the one big component, very big component. Sorry, just gonna exit out some of these chats. Beliefs, attitudes, values, and learnings that contribute to racial inequality, and everyday interactions such as norms, habits, scripts, how we talk. We were just talking about using inclusive language. You have some people who say, I'm going to say what I'm going to say, I'm not trying to change. And you have some people who authentically say, listen, I don't know, I really want to change. I want everyone to be comfortable, and I want to say what's appropriate so that no one feels excluded. And you know the difference between those folks, and when you talk about housing, that again can be a form of inequality, and back in 1968 in our, United States of Great America, the Fair Housing Act was extended to end discriminative housing and segregation, because people like my grandparents, when they moved here in the 1940s, and they were born and raised here in America, my family we've been here since slavery, and they came from Georgia. They came to Newark, New Jersey, and there were certain places where they could not buy houses. It was an invisible red line where you cannot buy a house there. So you had to buy houses where you were told to buy, and most of the times there were inequalities all around, whether it was environmental inequalities. So those are just some of the things I've talked about when we talked about systemic racism. And when you talk about social determinants of health, those are non-medical factors that influence health outcomes. So it's typically where people live, work, worship, and play, and where they're born, where they grow up, all that encompasses that. So think about those determinants of health. There's a factors that we might put in place so that we are not confronted with such inequalities. And I'll use myself for an example. Sorry. I told you about me giving birth to a preterm baby, 1 pound, 8 ounces. Let me tell you some of the protective factors that were put in place by my family to make sure that didn't happen. So I grew up here in New Jersey. I lived in Piscataway, New Jersey, and Plainfield, New Jersey all of my life. I graduated from high school. I went to a college here in New Jersey. I went to William Patterson College University first, and then I moved on to Temple University in Philadelphia and got my master's degree. I worked for one of the largest health insurance companies in the world. And I, at that time, was living in Connecticut. I lived in New York, and then I came back to New Jersey. I got married. So listen to all the key factors in my life here. Education, zip code. At that time, I was living in Edison, New Jersey. I could throw a stone to reach my obstetrician gynecologist office. So it was no reason why I did not attend my go to my prenatal visits. And remember, I had access because I worked for a great insurance company that gave me excellent benefits at that time. A health insurance company, might I add. So here it was when I was pregnant. I remember that day getting up and I was like, oh, feeling not good, but feeling good enough to go grocery shopping. At that time it was a Pathmark close to my house. And if anybody knows Piscataway Stelton Road, it's been a White Castles there. And I was pregnant. I was learning. I craved some White Castles, and I got White Castles and some cashew nuts. And I started not feeling good. And I told my sister, let's go home. And I remember calling the doctor, my OBGYN, and it was two male physicians, and he didn't answer the phone, but his partner did, who did not know me. And he kept poo-pooing me. Oh, Shakira, what'd you eat? And I said, oh, White Castle. He's like, well, that's gas. It's not but gas. I'm like, okay, gas. You got that. Full of onions. Okay, cashews, full of gas. But hours had gone by, and I called not again, the second time, and then a third time. And he honestly said to me, well, listen, you have another human being growing inside of you. What do you expect? Like, I should be expecting discomfort. So I was like, I got a little point. I got a health science degree, and the anatomy might push things around and pull things out of. I've got to understand that. But it was 1 o'clock in the morning, and I was in excruciating pain. And my mother-in-law said, you need to go to the hospital. My husband and I went to the hospital, and within 2 hours, my mother and my sister met me there. Within 2 hours, I had given birth at 26 weeks gestation to 1 pound 8 ouncer. Now, this is me. I told you all the protective factors, but I tell you this, and you can take this to the bank. When you braid in racism, all those protective factors that you think you put in place, that's nice and secure, it just unravels everything. So I say all that to say there's several other things in terms of social determinants of health that can impact what's going on with Black birthing people in the United States. Chronic conditions. A person's overall health is a strong determinant for pregnancy and health outcomes. I know we have some doulas on the phone. We have people who are birth workers. It's important that if people have chronic conditions such as diabetes, hypertension, their weight, overweight and underweight, okay, that can have an impact on what your birth journey looks like and your birth outcome. We already talked about implicit and explicit biases in healthcare. They're there. Their microaggressions are there. Economic and social factors. We know that there's inequalities in both of those pieces. Lack of paid leave. That's what we're talking about. Lack of paid leave, or unaware of paid leave, or fear that if I take my paid leave, there's going to be some kind of retaliation, or I'm going to not come back to my position that I worked so hard to get into. That was my mindset. Oh, wait, if I leave, then, I done came from Connecticut to New York to New Jersey, and I'm a big old time manager, and I'm making some money, and I don't want to lose this position because I done spent 8 years of my life going to school to get this position, and I was afraid. I was afraid to take it, the paid family leave. Housing instabilities, food insecurities, disproportionately, they affect Black people, again, because of the systemic racism that I talked about earlier. Mental health disparities. Black birthing people are less likely to have their mental health concerns addressed like they should, like we should. We have this term called weathering, and that refers to a psychosocial toll that chronic stress repeatedly, day after day, week after week, month after month, year after year, decade after decade. When I'm talking about Black Americans here in the United States, we're talking about centuries of stress and microaggressions and macroaggressions, or in your face disrespect that weathers, because stress, it takes toll in your body. It takes count. It doesn't just leave here today and gone tomorrow. And we know that minimized voices come with these biases. Sometimes you might, like my voice, you heard my voice. Doctor, something's wrong. Doctor, something's wrong. Doctor, something wrong. Oh, you had White Castle. Oh, you have a human birth. Come on. Not one time, just meet me at the hospital and take care of it. Just, put in your bill for it, whatever you need to do, So, those are some of the things. Solutions. because can't talk about all these problems without talking about solutions. Address the concerns of disparities, continuous implicit explicit bias trainings, and I'm not talking about a one and done. I'm talking about making sure that it's implemented in your everyday, annual, biannual, every quarter. In the state of New Jersey, Governor Murphy passed a law in May of 2021 stating that implicit and explicit bias is a shall, which means must, shall be taken by every healthcare professional and labor and delivery. And they're not talking just about physicians. They're talking about our nurses, our midwives, our doulas, even the person who says, "Hi, can I help you? What time is your appointment?" It all counts. That person, how their attitude. If you're in labor and you're in the hospital, someone's coming to change the sheets or fluff your pillows, how they treat you, it all counts. So everybody from beginning alpha to omega should be taking these trainings. And also, providers and practitioners, listen to your patient. Doulas, community health workers, birth workers, paid family leave organizers. If you hear something and you're not sure how to handle it, say, I'm not sure, but let me make a phone call. Let me get back to you. Listen to what the person's saying. Acknowledge, takes responsibility. If something goes wrong in a hospital or with a family practitioner's office or OBGYN, take accountability with what went wrong and make it right. It's no sense in making it wrong for a whole bunch of people until there's some, situation that goes on when you have to make it right. Do your due diligence and make it right. Make sure we're on collaborative teams. We have team births for everybody, hopefully circulating throughout the state of New Jersey. Go to a team birth hospital where you do collaborative, where you're included in the care, where they're coming to your bedside and want to include you in the care, and making sure that our birth workers and people who are working in whatever we do, it's diverse and it's inclusive. Okay.
Yeah, thank you. Thank you so much, Shakira. And Lauren's gonna have to actually hop off. So I just want to say thank you, Lauren, for being here, and for, your perspectives, and, for sharing such important information. And thank you so much, Shakira. I'm sorry, that I had to interrupt you. We're out of
No, it's fine.
for the
Lauren
panel.
said to make it the Shakira show. She said it.
Yeah, but it's not a problem. We love the Shakira show. So, thank you so much. And anyone that has any questions, I'm seeing questions in the chat. So, any questions, I'm actually going to note them down right now. And we will do like a follow-up, email, with answers to all of these. So just know that I am taking note, of all questions that are in the
Thank you
chat.
so much, Nat.
Yeah, and yeah, with that, I am going to pass it back to Yarrow, who is gonna be doing a training on New Jersey paid family and medical leave.
Thanks, Nat. Thanks, Shakira. Thanks, Lauren. Really great, amazing panel. I wish we could actually do this for even longer because it's so amazing to hear your perspectives and your insight. And you're going to make my job a little easier because some of the things that we are going to discuss you already have. So we'll move through the training fairly quickly. And this is just an overview of what we plan to cover. And some of the sections I'm going to have to go through a little bit quickly. But this is our journey and our training. I just want to mention that we do tailor this training and do other versions of this training to fit with different types of opportunities that you may have to do this training with your organizations, with your communities, with your members of your organizations. Excuse me. So actually, we do have a poll that we wanted to launch. You can go to the next slide. Let me see if I can do it. I apologize for my coughing. Okay, so we did want to let you all answer how familiar you are with paid family leave so we could get a sense before we embark on the training. Go ahead and answer that. And as folks are answering the poll, I'm going to take a drink of water. Okay. So I'm going to go ahead and give you just an overview so we're all on the same page. of what paid family leave is generally. So yes, as makes sense, it is wage replacement, replacing part of an employee's wage while they are on leave so that they can afford to take leave. And the idea is so that people can put their health and their family's well-being first, so that they can care for their loved ones, bond with new babies, adopted, and foster children specifically. It can include one's own health. So when we speak of paid leave in broad terms, usually we'll include the term or the word medical when we talk about taking it for your own health. But still, the majority of people that are taking family leave are taking it as new parents, as it provides time for infant-parent bonding and social support. It is important to note that we're not solely talking about parental leave, and I'm going to get into those nuances in a little bit. But thank you for everyone who did complete the poll. I'll end it and share the results so folks can see. We got a mixed bag. Some folks who aren't aware, others who have some but may be confused, and then others who are somewhat familiar, and a couple of you who are very familiar. No one considers themselves an expert, but hopefully by the time we end here, you will. All right, so go to the next slide. So the reason that some of you may not have heard of paid family leave or be really familiar is because the US does not have a national paid family leave policy. As you can see in this map, US is the only high-income country without a national paid leave. And there's really only 6 countries in the world that have no national paid leave, and that sometimes changes actually. But we joined the ranks of Papua New Guinea, Suriname, and a handful of other Pacific Island countries that actually don't even show up on the map. 186 countries offer paid leave for new mothers, and 174 offer paid leave for one's own health. And then, of course, most countries in Europe provide really quite long leave. So we are really falling behind as a country. Next slide. What the US does have is FMLA. And this has been around for 32 years, but it's just job protection when workers need to take leave if they're eligible for 12 weeks. It's not paid, of course. So many workers, and especially workers of color, are not able to access this unpaid FMLA leave. About 44% of workers overall are not covered by FMLA because of the eligibility criteria, and the rate is again higher for workers of color. Among workers who are not protected by the FMLA, nearly 0.6 million each year need leave, but they don't take it because they fear losing their jobs. This does also impact lower income workers disproportionately because they can't afford to take leave without wage replacement. They only have this job protection. So even if they are covered, FMLA doesn't help them at all. Next slide. But of course, in New Jersey, we are unique, and we were the second state to pass paid family leave after California, and our program has been around for nearly 16 years. There are currently 13 states and the District of Columbia that have a paid family and medical leave program that has passed, and some of them are actually implementing it this year. Next slide. I want to provide folks with a little bit of background on how we actually came to have New Jersey's paid family leave program. As you all maybe have heard, that we believe policy for people can be created through collaboration and coordination, and of course, coalition building. The coalition Time to Care that we mentioned before has been around for actually over 20 years, working with parents, advocates, small business owners, testifying, passing paid family leave in 2008, and earned sick days in 2018, and then expanding the program paid family leave in 2019. And so folks know how quickly time passes. The baby in the picture there is my now 6-year-old. So next slide. But it's just important to kind of acknowledge and recognize that, if you can go to the next slide, these policies are in place because of advocates and workers sharing their stories, sharing their lived experiences, and that's really important. And that you are all welcome to join the effort. Marching Diamonds and Garden State Equality, who are on our panel, have been involved in the coalition, and we are continuing to advocate to improve access and make our programs accessible to all. So yeah, there's the link there. We'll share with you again in our slides in follow-up. So before we go into the details of what paid family leave provides in New Jersey, I just want to echo some of what Shakira and Lauren and Nat kind of brought up, and the idea that paid leave is a health equity issue, and it's actually related to the concept of social determinants of health. Paid family leave can affect a lot of different areas. So when you have access to paid leave, you're more likely to have these things in the first part of this flow chart, right? So increased income, social support, time for bonding, time for self-care, and that can lead to the things in the next section. And all these pathways together can have the potential to improve child and maternal health outcomes. And then if you don't have access to paid leave, there's these ripple effects that contribute to the lack of access to having postpartum care, physical and mental health support, the ability to even find and access safe and affordable childcare. So these are aspects that we don't always immediately consider, but we need to think about paid leave as having this positive effect on these broader social determinants of health. And for those of us who care about the health of the folks that we serve. Next slide. So Shakira really did go into this a bit and how paid leave and the research and some of the research that they've supported can help improve outcomes for pregnant people and babies. But there is a lot of evidence supporting how paid leave can improve maternal, physical, mental health by allowing birthing people to recover from childbirth and adjust to, their caregiving responsibilities and addressing their own health needs. About half of birthing people report experiencing pain within the first 2 months following childbirth. Makes sense. Like having a baby, is a significant physical experience. And many of birthing people experience serious, potentially life-threatening postpartum complications. And the added stress and pressure of thinking about how to afford to take time off or having to return to work can really make those factors more significant. So it just makes sense that birthing people who take leave are less likely to experience negative health impacts. And in addition, postpartum depression. And those experiences are real and shown to be evident in a lot of the research looking at this. One of the research outcomes from ACOG identified that ACOG is the American College for Obstetricians and Gynecologists. They found that increasing access to paid leave was a key strategy for ensuring that birthing people can attend postpartum visits and get the care they need. So they have been coming out in support as a really important agency that's looking at the importance of these health outcomes for birthing people and their babies. And I did link here some of the research and how it's contained in one report around all these health outcomes. In the next slide, I just wanted to show you some of the evidence around the paid leave impact on the maternal mental health. And the Center for Disease Control and Prevention, their PRAMS, that's the Pregnancy Risk Monitoring System, found that women who took paid leave, that birthing people who took paid leave following childbirth were less likely to report depression. And this is really evident here in the different stages of recovery: pre-pregnancy, postpartum, and then newly diagnosed if someone is diagnosed with postpartum depression. So having access to paid leave really does reduce that risk factor. And the next chart is just a visual. Again, the same research also found that there is this disproportionate access to paid leave. 49% of pregnant people who were employed during their pregnancy took some form of paid leave following childbirth. But a significantly larger number of white women were able to take paid leave after giving birth than Black and Hispanic women. It's not in this chart, but also women or birthing people with lower incomes reported taking unpaid or no leave at all after giving birth than birthing people with higher incomes. So we do see this disproportionate impact on who has access. But in terms of the other benefits of paid leave, want to also just highlight that it actually is good for employers. We do hear from the business community often coming out and not in support, saying that there's a cost to business. But actually, when you look at the research, you see that paid leave can retain workers, their attachment to the labor force, and reducing the employee turnover costs. So actually helping an employer or business's bottom line. It also will reduce the long-term workforce disruptions. So the impact of being left out of the workforce for longer periods of time and having to find work, it does impact overall workforce continued involvement. And then it offers time for parents to arrange for stable childcare. If they can't find that, then it's going to mean their disruption in being able to return to work more stably is more likely to happen. And it can support employees' health and lower long-term healthcare costs. Also evidence around boosting workforce morale, productivity, and job satisfaction. And then, of course, just the idea that workers can achieve a better work-life balance. Next slide. And there's a lot of additional evidence. I'm not going to unpack it because it really is quite a lot around, not just the birthing person and child health, but also engagement by fathers and other non-birthing partners and building the stronger relational ties that they have. And then also addressing the racial and gender inequities in health and the workplace and in earnings, and the idea that strengthening families' economic well-being does strengthen the overall economy as well. So a lot of this is common sense, but a lot of the research is supporting it, and we want to make sure to share that. Okay, so let's get into it a little bit. So really, the law around paid family leave was established, again, to offer workers partial wage replacement, but it can be really confusing. One thing we just want to always mention is that family leave is not FMLA. A lot of people conflate those. FMLA is job protections, and I will talk about that in a little bit. But in New Jersey, we have two paid leave programs. Essentially, we talk about paid family leave, but we also have paid medical leave, and that's temporary disability insurance, or TDI. And then the paid family leave is called family leave insurance, or FLI for short. So we're going to first unpack and talk about what family leave, or FLI, provides. So workers use family leave insurance when they need to take leave to bond with a new child, cope with domestic or sexual violence, and also to care for a loved one. So those are the main areas. And the next slide, we'll talk about bonding. So bonding is important to understand for family leave. This is not maternity leave, as we mentioned before. Bonding leave is for both parents, birthing, non-birthing parents, same-sex parents, adoptive parents. Any parent of a child can be eligible to take up to 12 weeks of leave to bond with a new child, birth, placement, or adoption, again, in the first year. So really, it's not about the identity of the parent, whether it's the mom or the dad, it's any parent. All right. So next slide. So in terms of taking leave to cope with domestic or sexual violence, this was part of the expansion in 2019. And this was not just for the individuals themselves who are coping with those issues, but also for those who are caring for their loved ones who are coping with these issues. And they can take family leave to seek medical attention, therapy, victim advocacy, legal services, recovering at home, seeking safe shelter, and more. So really any issues related to coping with domestic or sexual violence. Next slide. And in terms of using family leave insurance to care for a loved one, workers can use this to care for any loved one who has a physical or mental health condition. This is usually more serious health conditions that are certified by a healthcare provider that require some amount of recovery or healing. Next slide. Part of the expansion was to broadly define who is a family member. And the law now says it's any family member or individual who's considered to be family. The technical definition is any individual with a close association equivalent of a family relationship. But the law also does explicitly list out child, spouse, parents, siblings, grandparents, grandchildren, in-laws, any blood relation, as well as chosen family. As we talked about before, this is really important for LGBTQ plus people and also people with disabilities. Often they are disproportionately, they need to rely on loved ones instead of blood relations to care for them. And so this is a really important piece of the inclusive family definition. New Jersey was really the first state to pass this. And so we want to make sure folks know that they can use it to care for anyone who they define as family. Next slide. So who is eligible? It's important to understand that in New Jersey, most workers are covered in the family leave insurance program. It's not just a few select folks. So really, if you are an employee in New Jersey and you are with a valid Social Security number, family leave insurance is available with a few exceptions. Federal government employees, they have to see what is available to them. Out-of-state employees, faith-based organization employees, and workers who are not technically employed and are considered independent contractors. Sometimes people are misclassified, so that's important to make sure that someone is actually exempt from being considered an employee. But this is the broad majority of workers in New Jersey who are, in fact, covered by family leave insurance. In terms of qualifications, to be eligible, you do have to have met minimum gross earnings in about the year and a half before you take leave. So this is where kind of the rubber hits the road in terms of the details of who is eligible. It's about what you've earned, though, not about how long you've worked at your employer or how many employees there are at your employer. So for 2025, you have to have worked 20 weeks, earning at least $303 in those 20 weeks, or you can look at your combined total of earnings in about the year and a half before you take leave. That's considered the base year period. And that's $15,200. That is quite high for some workers who may have just entered the workforce or have been working part-time. And we are actually advocating to change the eligibility criteria. But currently that is the standard for being considered qualified to receive these benefits. Workers are contributing in their payroll taxes to the program, so it essentially is their money. Next slide. In terms of what is available, the timeline, there are 12 weeks of benefits available if you take them consecutively, or if you break it up, you can take 56 individual days or 8 weeks. This is considered intermittent leave, and this is available every 12-month period. And the benefit provides for 2025, this adjusts every year. You can go to the next slide. It's 85% of your average weekly wage, and the maximum for this year is $1,081 a week. And this is something you'll make with the average weekly wage at any employment that you have. So all your earnings will be calculating this percentage. Although depending on how much you earn, you could hit that weekly cap of $1,081. But there are delays in claims and the ability for folks to get paid. And this is an area we're also advocating for change so that people can receive their benefits quicker. The next slide, we're actually going to talk briefly about temporary disability or TDI. This is, again, the medical leave. So for your own health. The eligibility and the benefits that I already described are the same for temporary disability as they are for family leave insurance. This has been around actually since 1948 in New Jersey. And this is sometimes when you use the term maternity leave for somebody who's taking it as a birthing person, this is actually the program that will cover your wage replacement. So you can see here in the middle, pregnancy and recovery from childbirth is one of the reasons that somebody could take TDI. But it's really any physical or mental health condition that a healthcare provider can certify that someone cannot work, that you can take disability for. And that includes gender affirming procedures here. Next slide. So just some of the basic details around temporary disability insurance. It's available for up to 26 weeks a year, as long as you have the medical certification from a healthcare provider. And the exemptions are a little different for temporary disability. Federal employers are exempt completely, but county and municipal employers are not required to participate. So many of their workers, that includes public school teachers or other public school staff, are not necessarily participating in disability, but hopefully the employer has let folks know and that they should have potentially purchased a private plan, which is always an option that someone can do. But in terms of the state benefit, it does cover the majority of workers that are not exempt, as described here. Next slide. So just to give you a little bit of a overview of the steps for the birthing person when it comes to taking paid leave. They would take temporary disability benefits first if they're covered. Typically, that's 4 weeks before your due date or when a doctor can certify the disability. And then you just go online, myleavebenefits.nj.gov. That's the Department of Labor. They oversee the benefit program. You submit a claim there when really you stop working and you're not getting paid from your job or full pay from your job. An employer can pay the rest of your salary since the wage replacement is partial. But if you're receiving full benefits, if your employer does offer any type of paid leave, you're going to want to wait until you're not receiving full pay. And again, your doctor says certified that you're unable to work due to the pregnancy. And then after disability for someone's recovery, which is typically 6 to 8 weeks after they deliver, depending on their recovery timeline, they can access bonding, and that's family leave insurance again. And they can really do that anytime before the baby turns 1, but a lot of new birthing parents do take it immediately following disability. For the non-birthing parent, they would actually be applying anytime after the baby arrives, before the baby turns 1. Okay, and the next slide does just give you a link to the Department of Labor's maternity timeline tools, what they call it. And it does help folks outline the calendar for what they might be looking at when it comes to taking leave. So that's a helpful resource. And I'm coming up on time, so I'm going to move a little quickly here. But I just want to let you know that there is a lot of information that we think is related, benefits and programs that are helpful for folks to know about. And when I mentioned before, FMLA is not the same thing as family leave insurance. This is a big part of confusion. If you can go to the next slide. And the next one. So the FMLA and the New Jersey Family Leave Act, again, this is different than family leave insurance. These are the laws that explicitly protect a worker's job when they're on leave. But it is still illegal for an employer to retaliate against an employee when they are trying to take their benefits, and an employee has the right to take private legal action. So that's important to note. In the next slide, which I'm not going to have time to go into detail, but again, we'll share these resources and follow up. This is also a link where you can get more information about the distinctions between paid leave eligibility criteria and job protection criteria, because somebody could be eligible for paid leave and be able to take the benefit, but not have access to the job protections. And that's important for folks to understand what, what is important to them in thinking about taking leave. And then in the next slide, there's a really helpful flyer here about the Division of Civil Rights overseeing of the Family Leave Act. And this is the state law that protects workers' job for caregiving and bonding. And so this is a really helpful flyer that we like to share with people. And in the next slide, I did share detailed information about the law against discrimination, which was mentioned earlier in the panel. These are really important protections and really are very comprehensive anti-discrimination laws. A range of protected classes from disability, race, religion, natural origin, nationality, gender expression, identity, sexual orientation, pregnancy, breastfeeding. These are all identities or experiences that are protected, and employers must treat workers equally and cannot treat people differently based on any of these statuses. And so this is a really important protection to know about. The Division of Civil Rights in New Jersey oversees this law, and if someone has questions or concerns about if they're being discriminated, that's the agency to turn to. And also in the next slide, again, this will be available to everyone, but the law against discrimination was expanded by the New Jersey Pregnant Worker Fairness Act, which does require employers of all sizes, doesn't matter the size of the employer, to accommodate pregnant workers. And that could include the right to job protected leave as well. So if someone doesn't qualify for job protections under FMLA or the New Jersey Family Leave Act, they might want to look at if they're protected under this law as well. As I sort of wrap up here, I just want to say, well, one final thing for Know Your Rights in the next slide is the Earned Sick Leave Law. This is an important law that covers all workers regardless of immigration status. An employer must provide at least 5 paid sick days a year. It doesn't matter the size of the employer. And that can be used for any of your own health needs as well as caring for your family. And the employer must pay the worker directly for that minimum amount of time. And then we did want to share a little bit about some of the barriers the gaps that exist in terms of accessing paid leave. Some of it we already kind of unpacked: awareness, understanding, and then of course fear. And the fear is related to really losing your job and the ability to take the leave without repercussions. And that's an area in which we're working. You can see in the next slide that 1.7 million workers actually don't qualify for job protections under the Family Leave Act. And that's a huge number of folks. It does disproportionately impact lower income workers, workers of color, and New Jersey's really behind in this area. So this is an area of advocacy that New Jersey Citizen Action is working on. If this is something that impacts some folks that you know, please let us know and connect us. We are trying to make access to family leave without the fear of job loss a priority. So I'm going to actually let folks put any questions in the chat, take a couple extra minutes to see if you want me to address anything now while I'm live. And then Nat, if we could launch the poll, see if folks learned anything, even though that was really, oh, sorry, this was the poll from before. That was a really fast training. Wanted to make sure that we ended not too much later. Let me see. I can launch it, I think. There we go. So how familiar do you feel with paid family leave now with that whirlwind of a training? Do you feel like your knowledge expanded a bit? And maybe if we send you the slides and the recording and you can go over those, you will feel even more confident in your understanding. Okay, so I can see that I don't know if any of the questions were asked that didn't get answered. Do we want to try to address?
Yeah, and I'm also, just to let everyone know, I'm gonna stay on for a few minutes after this to just note down everybody's questions. But let me try to scroll to the first
Yeah,
question.
we understand if folks have to go. This was the time frame that we set, but we will stick around for folks that want to have their questions answered live. Okay.
Yeah, so I'm seeing what can we do or give undocumented families who can't even qualify for benefits like paid leave or can't access healthcare due to fear, cost, or other factors?
Well, first, it's important to know that all children are eligible for the NJ Family Cares, regardless of their immigration status. So just that's important to make sure that our families know. And as I mentioned in the concluding part of the presentation, which I'm sorry it was so fast, is that earned sick leave is available to workers. The employers must pay that or it's considered wage theft. They can file claims with the Department of Labor if they're not being paid for any of their sick time. The other protections that are afforded to workers, regardless of immigration status, are those laws around discrimination protections. Also, the laws around leave, it's regardless of immigration status. And also, we are working so that anyone who is able to contribute, being paid, with a paycheck, is able to access the benefit regardless of having a valid Social Security number or not. So that's something that we are advocating for. So let us know if you want to get involved in that effort. But for now, it is limited in terms of undocumented immigrants not being able to access those benefits except for the earned sick leave and job protections.
Yeah, and I'm also seeing when you say available every 12 months, does that reset with the calendar year or 12 months from the first day of your previous leave?
Yeah, it's from when you've taken leave. So it's based on your own timeline of when you've taken leave. So the state will essentially restart the benefits that are available to you after your leave, after you've taken leave again. So it is a problem in terms of job protection under the Family Leave Act specifically. because that's actually only available every 24-month period. But in terms of FMLA job protection, it's every 12-month period. The benefits are available every 12-month period.
Great. And yeah, I'm seeing a few folks just asking if this training is going to be shared out after to just and just to confirm with y'all that we are recording it and we will send out the recording.
Yeah,
to
and in conclusion, Nat, if you can go to the next slide, just I don't want to hold. I hate always going over time, but we wanted to at least cover these. One of the things we always make the case for, if you work with communities, if you work with families, you really are a conduit of information. And that's really where people are understanding what's available to them, is actually in conversation with real people like yourself. So if we can do, and you can go to the next slide too, if we can do anything to support your understanding, your staff, your coworkers understanding, we will do that. So these are some resources. We will come to you and do trainings if you need. You can use the referral one-on-one guidance link, as well as if folks have stories they want to share, and if people want to get e-action alerts, they can sign up for those there. And then there's also a set of materials that is available on the Department of Labor's website. These are materials that, if you go to the next slide, they're digital, but also the Department of Labor will mail out copies of at least 100 of any of these flyers or handouts. You can see them on this link here.